Good evening. My name is Kathlene Caparros, and I'm from the Philippines. So today I will be presenting my final presentation for books and discussion. So let's start with my agenda first is to discuss the related literature that will finalize the methods for the data gathering. Next is to finalize the topic, which is the COVID-19 that can be applied to mechanical ventilator. This is my related literature topic, which is predicting invasive mechanical ventilation in COVID-19 patients. So, this is a validation study that was held last January this year, 2024. So, just to have a quick review, I will discuss again the COVID-19 category. So, first is the mild, moderate, and severe. On the first one is the mild, which is obviously a mild symptoms that can be treated at home. For example, cough, colds, and fever that can be managed by having some rest at home and by taking generic medications like paracetamol and so on. So on this one, you can self-manage yourself at home, which cannot be lead to go to the hospital. Next one is the moderate COVID-19. This one is can also have check in the clinic and give some certain medications. For example, the patient came into an outpatient department or clinic. It's because the patient feels fever for more than 5 days, and he treated himself at home, but the patient is not improving, and also he also has a cough for more than 5 days. So with this one, they decided to go to the clinic, which they have some certain diagnostic tests like blood workups and most probably chest x-ray. So on this one, the doctor can have let him check up right away. Next one is the severe COVID-19. So on this one can be uh, urgently treated at the hospital. It's because what are the basic symptoms or initial symptoms of the COVID-19 severe is difficulty of breathing. So as you can see here, it can be admitted in the hospital, most probably in the ICU, and that could result in intubation using mechanical ventilator. Next one is the introduction. So on this one is important. This is very important to validate a previously developed algorithm designed to predict the necessity or the necessary for invasive mechanical ventilation or IMV in COVID-19 patients. So as you can see here, first is on the emergency room is first is the decision to intubate. Next one is decision to ventilate or give oxygenation that could result to a clinical setup. So this is very important for every healthcare providers, especially the doctors, in order for them to proceed with this invasive procedure, which is the mechanical ventilation. Next one is by both delaying the intubation and unnecessarily invasive ventilating, this could result in a harmful situation for every patient that sometimes lead to death. Another thing is the various clinical situations. So, since our topic is respiratory care, this is one of the examples that could lead to death for every patient. So first one is the hypoxemic respiratory failure. So hypoxemic or hypoxemia, which means decreased oxygen in the blood. So with this one, if the patient feels this kind of condition, he or she can have a difficulty of breathing. The next one is a chronic obstructive pulmonary disease or COPD. So on this condition, uh, the one thing that is very expected is it feels like they always breathe fast because of their conditions, which the most symptoms that they had is smoking. Next one is the community acquired pneumonia. So this is infection of the lungs. Most probably if the patient had a history also of smoking and also a cough for more than 3 weeks. And lastly is the acute respiratory distress syndrome or ARDS. So this is also a group of the respiratory conditions as well, together with this kind of various clinical situations. On the next slide is the methods. So first is on this paper is they use a data set of COVID-19 which are admitted. This is very important to organize if the patient is admitted or not. Because, like for example, if the patient is not admitted, which means they just have a checkup in the clinic, but they are not admitted, it means they have the different kind of situation or data gathering together when it comes to the analyzing the COVID-19 data sets. And when the patient is admitted, this has a lot of data together with the blood tests, series of blood tests, and together with the chest x-ray results. Next one is the algorithm to develop a algorithm. This one is very important in order to combine the data set of COVID-19 by applying the mechanical ventilator itself. Because, for example, you want to learn how to use the mechanical ventilator. It is very important to know the guidelines and how the initial setup will be uh, starting first. Like, for example, how to or what should I do first when I use the mechanical ventilator? This is very important for every healthcare providers because with this one, they will be fully aware or very confident on how they will apply it for every um, patients that needed in the ICU. Then lastly is to evaluate the model performance in predicting the ventilation. I think this is very helpful nowadays because it's not that we are not um, respecting the decisions of the clinical providers like doctors. It's just that in biomedical engineering, by applying the AI or deep learning, this can be very helpful. It's because it will make the work easier for the doctors and respiratory care professionals. Like, for example, a doctor and a nurse is working in a public hospital as a 100 bed capacity. Mm, for example, the setup is pandemic, so they have a lot of patients, more than 100 persons. It can be very difficult for them that could result into burnout patients. I mean, burnout doctors and nurses, which they will not properly function themselves. It's because of a lot of patients. So with this one, by evaluating a proper model performance and predicting ventilation is very important to improve the life of the patient and also to make the healthcare professionals um, lessen their work properly and also saves time. Next one is the methods also, which was first is study population. On this one is they had this topic by March 1st to February 23, 2022. So these are the included data that they need. First is experience hypoxemia, or what I said a while ago is decrease oxygen in the blood that could result in below 88%. Next one is hospitalized for more than 48 hours. My question is why more than 48 hours? Why not 24 hours? I think it's because 48 hours has a lot more observation for the patient. Also, on these hours, they can have some series of blood results together with the chest X-ray, so they can monitor or evaluate what is the actual condition of the patient. And if we choose less than 24 hours, maybe the data is not enough to provide to apply for the methods. The next one is do not resuscitate, which means do not revive the patient if the patient can experience a deterioration later on, and do not reintubate. So when the patient is intubated, it means they do not need to reapply the intubation afterwards. And lastly is the excluded with this one is ventilated upon arrival. For example, it's because when the patient came in ventilated, it's because the management is came from the other hospital. So they started first the procedure on the different hospital, and then they will transfer it upon the arrival. So it has a different management on the first hospital. So it's just that the second hospital will continue the treatment for this patient. Next one is the algorithm validation. So on this one is predictions hourly, starting from 12 hour of the admission for a future time of 4 hours. And lastly is beginning 6 hours from the prediction time. So it is important, in short, that they need to monitor the patients hourly in order for them to have a data set uh, rules to have a complete accurate result. And last one is the categorized model development. So on this one is to assess using the same statistical measures as the original algorithm. I think mm, this is very important because the original algorithm is very generic and basic. Like for example, we want to know how to uh, use the blood pressure machine or BP apparatus. It is important that we know first what is the basic information and what is the basic steps in order to have an accurate result. So I think every algorithm, it is very important to apply the original algorithm. The results. So on this study, on this literature of study, they had 881 patients that was admitted to the Rabin Medical Center, and that was between March 2021 to February 2022. So on this one, 96 patients that required invasive mechanical ventilation, and the AUC model is 0.95%. So I think the accurate prediction is high, which is a good result. And I think it could be a continuous learning process, especially with on how to improve the algorithm for every topic. So on this table number two is the distribution of the hypoxemic patients according to the invasive mechanical ventilator treatment and mortality, which is death. So as you can see here, this is invasive mechanical ventilator and then no invasive mechanical ventilator together with the total number of patients, which is 881. So as you can see here, um, there is a more number and no invasive mechanical ventilator which compared to the invasive mechanical ventilator, because this one is they applied a model or a proper model that use an algorithm. Mm, okay, and next one is, as you can see here, the alive total alive patient is 29 only, but if they did not apply a mechanical ventilator, it could uh sorry, what I mean is, on the invasive mechanical ventilator there result 29 persons, and then on this one is 617 that could result in 646 patients. So as you can see here, mm, they applied this one on the dangerous patients like severe COVID-19 or other various clinical situations. Maybe on this one, they are not seriously needed the ventilator. But as you can see here, they focus on these 29 persons and they still alive. It's because they follow the algorithm by using the deep learning of the mechanical ventilation guidelines. And the overall, that could result in 881 patients. So with this one, they cannot predict first. It's because maybe they have some certain data that are not applicable. Like what I said a while ago, there is an included data and excluded data. So this is a zero prediction, and this is mild, and this is moderate, and this is a strong prediction. So with this one, maybe they had a complete set of data that they applied for the machine learning in order for them to apply the correct algorithm for every patient. Okay, with the final conclusion, the high predictive accuracy results ranging from 0.87 to 0.94, and the algorithm predicting the respiratory failure and the invasive mechanical ventilation is very important to know uh, for this COVID-19 patients. On this final conclusion, just to summarize, I think the potential as a reliable decision support tool for clinicians is important to manage during the COVID-19 patients. And by using the algorithms, applying the deep learning together with the compatible model, it is very useful, and I think this can be um, a future um, a future help for every paper to improve the real life scenario of the COVID-19. So, with this one, I would like to thank you everyone for listening for my presentation, and I hope everyone will finish their um, report as well soon. Thank you, everyone, and good night.